As a little kid, my parents had bought me a Boy Scout manual at a garage sale. And I remember very distinctly cutting out the first aid section, stapling the binding on it, and folding it up and putting it in this little blue wallet. And I carried that thing everywhere. And to me, I've always had the instinct of wanting to be in healthcare. I grew up in a super loving household. My parents showed us nothing but love. So being able to show my kids that, to be able to show my patients that, it's just an extension of who I am.
Jeff is a people's person, and what drew me to Jeff from the very beginning is his empathy.
As a male going into nursing in the 90s, it was one of those kind of taboo things. But I persevered and I said, you know what, this is really what I want to do. I was seeking that connection to the patient. I was seeking the ability to interact on a human level, not just be an assembly line.
He is there to support not only his patients or their families, but his fellow nurses as well. If there's ever a crisis, he's the one to be there in the very beginning.
As a 25-year-old, this is what you've trained for your entire life. And there were no patients. There were no patients. You know, you go down there and you're trying to save lives, and all you're seeing is death around you and devastation. There's no patients to save. So that was one of the things that I still live with, 18 years later. I think that day taught me that perhaps I was spared. There were other EMTs and medics that died that day, and perhaps I was spared in order to be able to be part of a team that saves lives.
Jeff's always looking to step out of the box. He's looking to see, what more can I do? Jeff runs educational modules on his unit, helps with interns, externs, and that is Jeff, and that's what makes him special.
As a mentor, he knows when to step back and kind of let you figure things out, but he also will be right there behind you if you need anything, which I think is a very good balance.
If I can help somebody else to save a life, that in itself is a reward. Nursing isn't what I do for a living. Being a nurse is who I am. They always say that nursing is both an art and a science, right? And the science is obvious. It's the art that's a little bit more elusive sometimes, I think. And that art is that human connection, that connecting to another person and saying, I understand what you're going through. I've never experienced it, but we can get through it together. They feel you're on their team and you're partnered with them to provide them the best care that you can.